My transition was okay, but I went from being on a children's ward with my mum and everybody that I knew to being on an adult ward with 5 dementia patients and nurses that didn't really know how to look after me because I was so young. And I didn't have that continuity of someone from adults coming over and saying, look, I'm going to take over your care, let's get to know each other, what do you want out of life? If I'd had that, the jump wouldn't have been so big, because at the moment it is a jump. And it does feel like that. You do feel like this huge leap into the unknown when they say you need to transition. It's kind of a scary thing, I suppose. I was scared because I knew my paediatric specialists and they knew me and they knew what I wanted, whereas the adults didn't. And sometimes the doctors forget that we are young adults, but we're not mature adults yet. So we might need a little bit of help. We might want our parents there. We might want, someone else there for us, because we're not, middle-aged adult that's had lots of life experience. We've only just transitioned over to the services. But had mine been improved, I mean, my social care one was okay because I met everybody first, but that health was a big jump. But obviously I'm campaigning with Together for Short Lives to get this improved. And even my consultant that I moved over onto the adult services for, he has used what I've said to improve their transition services at their hospital, which is where I made my transition. And that is really important to me because I feel like they've taken on board what I've said. I wasn't criticising them, they know that. They were just saying that this is what you could do to make it even better, and they've taken that on board. Because in children's services, and this is probably going to come out wrong, but you feel like you're important. But I've found out in some adult services, they haven't got the time. So consequently, you do feel a bit kind of, do I matter? Does what I want out of life matter? Because they're just so overstretched. Whereas the children's services, they tend to have time for you and, they kind of handhold. So for a young adult, going from all this support from all these children's services to being one adult doctor and his team, or you lose that safety net that you used to have. And again, sometimes doctors don't like having your parents there. I've experienced that, whereas I want my mum there. And they don't seem to understand why. Because I'm an adult, why aren't I making my own decisions? That kind of attitude I've had in the past. Yeah, I'd say starting earlier, getting the young people to meet the teams that they will look after, but the consultant, but also like the nursing team and all the people that they will have contact with, getting to know them first, so that when they transition over, that adult doctor has an opinion of and has an idea of what the young person wants out of them, out of life, out of all the other services. So when they make the transition, they're all on the same page. And I think that's really important. Just being able to meet the people first would have helped me a lot, because you just feel like you've kind of had a chance to know them before you've been kind of pushed across and left with them.